The division supports using the forms created by Fostering Health NC. We actually participated in their development. The forms are available in Microsoft Word, so they can be tailored for the local needs, as well as in a printable and fillable PDF so that medical providers and social workers can use them. We also allow them to be used instead of the 5243 and 5244 rather than in addition to. The forms have always been important as a way to communicate a child's needs to a foster parent, but they're even more important now through this initiative to increase communication between the local child welfare agency and the medical provider in making sure a child's health needs are being provided. The goal is to facilitate coordinated care as well as include that foster parent in the coordination of care. The social worker is primarily responsible for filling out the initial visit form, and hopefully that's provided to the medical provider prior to the first visit. The subsequent comprehensive visit form is going to primarily be completed by the medical provider.
Physicians use the health summary forms for children that are entering foster care in very important ways, and that's to help expand their understanding and knowledge of the past medical history of the child. That includes both the medical history and their social history, developmental history. It's important that we have this information. Why is it important? Because so often it's assumed that physicians are magic, and just by looking at a child, we can tell all the things that have happened to them. And that is just not the case. Unfortunately, many things we might not have or we might miss if we don't have a complete history to accompany the child. Understandably, some of this history may be missing, but what's important is to gather as much as we can, and so all of the history that we can have available to us greatly enhances our ability to make accurate diagnosis and provide appropriate feedback to child welfare, the foster home, and make plans of care for the child that's individualized and appropriate. The initial visit is important to identify things that are very acute that we need to know. Are they on current medications that need to be continued at this time? Do they have some type of contagion that would be appropriate to treat the child or might be appropriate to make sure that the foster family is not exposed to things that we should be treating the child that's entering foster care for first. I think it's important to also to understand that this information is used to make sure we don't overtreat children. One of the most disappointing things that I had seen in working with children entering foster care would be if we were missing information about, say, their immunizations. And appropriately, we want to make sure that they are up to date with their immunizations. But more times than I care to relate, those children have received more immunizations because later we discovered that, in fact, they had already had them. So that's just one example of how it can be used to make sure we don't do things for children entering care that don't need to be done. It's important to understand, too, that this is a very cooperative effort, and that as much as child welfare can give the physician will greatly enhance our ability to then go and look for perhaps other information that will then make everybody much more able to respond to the individual needs of that particular child in foster care. The initial visit is a form that's used to gather information that's critical in the immediate care of the child. So this would address things such as a child that would need immediate antibiotics or continuation of medication. It also includes things like food allergies, or if the child has an allergy to medication, important types of things that could relate to acute situations in the child at that time. We gather some past history as well, although all of that may not be forthcoming at that initial visit. But it's critical to have things such as allergies, medications that need to be continued, children, for example, that need asthma medication or EpiPens. Those kinds of things are critical. We want to make sure that the children are getting appropriate medical and safety care while they're in our custody. Trauma is almost universally a part of children that are entering foster care, regardless of what reason. To be separated from their home, from their parents, from their caregivers is traumatic. How different children react to that depends on many of their own developmental aspects. But we do know that it's important to look at those aspects because it will have an influence on how that children responds to the medical care that we're providing. So it's very important, and the comprehensive visit is an opportunity for us to gather more of that information, both from child welfare, but also for us to be sharing that information back so that we can look forward to making sure that the child is on the best road we can in terms of their health and well-being. There is also a well visit, we call it, form, which really corresponds and is made specifically for children who are in out-of-home care. The reason that this has been developed is because it's more specific to looking at some of the changes that might happen with children in foster care regarding their placement, which may change, some of the therapies may change, and then it's just an opportunity for us as physicians to also make sure that all of the different types of care that this child is being given are being coordinated and followed in a more regular manner. Children in foster care are recommended to be seen more often than are children who are not in out-of-home care. The reason for that being is that they do have additional stressors, changes in their environment very often, and those things need to be checked much more regularly than we might do for children who are not in out-of-home care. All of these forms work together to provide a very wonderful opportunity for physicians to get information from child welfare about the child, and conversely, so that physicians can provide that information back to child welfare while coordinating and enhancing the child's physical health and well-being.